Hi everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching our video today. We've got one patient in this video, but we've got two very different ear canals here. So we can see this first ear canal. This lovely gent normally comes through about every 12 months thereabouts to get their ears cleaned up, but he only came through about 3 months ago to get this done. And what we can see is we're pretty full in here again. So what we've got here is the standard size Zollner tube in here, and we're just working our way down the ear canal. So we've got this quite soft consistency of wax there. Now you'll see these little lighter flecks in there that seem to be almost like mini skin ribbons, and that's exactly what they are. There's little bits of skin embedded in here as well. So when the wax is picking up these bits of dead skin and working its way out to the outer part of the ear canal, it's designed to fall out there. But what we can see is we've got almost this layer of drier, thicker skin that seems to have detached from the canal wall for some reason and then folded over this wax. Now what we're having to do is work through the wax plug in the center and then slowly peel this skin off the side of the canal wall and drag this over. Now guys, don't forget we do post new videos every Monday through to Friday at 9 PM UK time on all our social media platforms. If you do enjoy these videos, then please consider, put my teeth in, subscribing or following the channel depending on which platform you're watching it on. Got it done early today. So you can see now we're just lifting that little bit of skin away. I've introduced a little bit of olive oil in here just because that skin was really tough. Now make sure you stay tuned for the second ear canal because that's where we show you a fungal ear infection. Now fungal ear infections are known as otomycosis. If I'm going to use any medical terms, guys, I will pop them on the screen somewhere in written form so you can see what we're actually saying. So I know it's difficult with my Welsh accent as well sometimes to pick out what I'm actually saying. So we're just working our way down here. You can see these little bits coming away. Now, I do wonder whether this patient had a little bit of a fungal infection in this side, either much milder version, which is causing this layer, this thick layer of skin to come away really easily. Looking at the time scales involved for this particular patient, normally they're regular as clockwork coming through between sort of 11 and 13 months, and this one's 3 months later, and we only cleared this out really recently. So something's changed in this ear canal to cause this to happen. Now I suspect, because we've got this fungal infection, this otomycosis on the other side, I suspect that we're getting some of that in here as well, but we haven't got the classic signs and symptoms of a fungal infection in there. So patient has been experiencing some hearing loss, yes, but normally you get a little bit of itching, some swelling to the ear canal, and you'd be able to see the infection. I'm not going to go any further into detail while we're looking at this ear canal. We're going to show you that in a bit more detail on the next ear canal, okay? So make sure you stay tuned for that one. So we're just working our way down. We've got to that central core. Now we always look for this plug of wax, this slightly harder piece of wax is always resting in the center there somewhere, and we're just drawing this down. You can see that thicker skin layer that's detached there right at the top, and how that's really affected all this wax underneath and really held it together, enclosed it, wrapped around it. So it's very thick. Now if we watched the last video, you know that when this skin comes away, so when these epithelial cells come away from the side of the canal wall, they start to harden. Now we're talking then about the sort of keratin. It goes that sort of feeling like nails, thicker, harder material. We talk about keratosis or obturans and things like that as well. That kind of thing where you get this tougher layer. That's the sort of outer skin consistency we're talking about here. Plugs come away really nicely there, detached really well from the canal wall. You can see those almost ripples of skin around the outside edge there as well. So let's take a look behind that. There we go. We can see the eardrum now. Patient hearing a lot better there. There we are, just a little bit on the outside edge we needed to tidy up, and we'll get these little bits off the bottom. So there's no trace of any sort of redness, any irritation in here. The skin of the ear canal wall looks good. This is what it looked like beforehand. And I think we'll show you, there you go, that's what it looks like after. We, for some reason, didn't fade in and out then, guys. I'm not too sure what happened there on the editing. So this is the second ear canal. The first thing you'll see, camera's missed it up. This is a humid ear canal. Now, when we talk about fungal infections, or otomycosis as it's known when it's a fungal infection in the ear, this is more common in these sort of more humid tropical environments. It's far more common as South Wales is not known for its tropical environment, so you do sometimes get these issues that just crop up in the ear canals. Now, there's two really common types of fungal infections. So Aspergillus is one, and then we've got Candida is the other. They present very differently in the ear canal. I will show you. This is actually an Aspergillus infection. The reason we know that is coming up in a few seconds, but we're just working our way down the canal. Now you can see the wax is a slightly different consistency. It's a little bit more kind of, not mushy, but a little bit wetter in here. Now we talked about this humid ear canal earlier on. We're just working our way down. There we go. You can see all these little bits getting sucked in. Now, there. Can you see those little spores? I'll point them out to you. There you go. Those little tiny yellow spores. Look like little tiny match heads in there. Now, that's classic Aspergillus. If you get these spores coming out with these, they can either have little yellow tips to them, or you can have black tips. So it's Aspergillus niger, those kind of things, where you can really see all of that fungal infection in there. It's all clubbed together, and it's really kind of bound together in there. As I said, far more common in hot, humid environments, but patients do get these kind of issues. Now, what we're doing here with this Aspergillus infection is we're taking this away. We're pulling all of the infected debris out. So we're getting rid of debris. Okay, that's what I want you to remember. It's not necessarily always the infection, because what you'll have is that infection will be in the skin. It'll be sitting on the surface layer. We're getting rid of the visible debris. It doesn't get rid of the infection on the inside. So this patient would still need to have some treatment as far as that infection's concerned. You can see how it's killed off almost that surface layer of skin, causing it to detach and harden up. It's also going as a very thin layer over the eardrum. Now, the type of medication you'd use for this type of problem, most of the time you can get over-the-counter drops for this. In the UK, we'd use a Canesten drop basically for this type of thing. If it was a candida infection, now that's more commonly known as thrush, and what you'd get then is a more creamy layer. I always imagine it like the skin of a custard or the skin on gravy. You know, you get that thick layer and then that sort of slightly wetter layer underneath. That's the sort of consistency we're talking about with candida. With Aspergillus, it tends to be that little bit drier, these little spores all sticking out. Now, take a look at the bottom of the ear canal here. So we're just in front of the pars tensor. Do you remember what we talked about last time about your pars tensor, the bottom 2/3 of the ear canal, pars flaccida at the top? That section there, you can see the skin there. Remember I said that the epithelial cells on the surface of the eardrum, as you're looking at it there, form the canal wall skin. Look at this. This is a classic example that has been affected by the fungal infections, the otomycosis. As we try to lift this up, look where it goes. It doesn't stop at the edge of the eardrum. It carries on over the surface of the eardrum. There we go. You can really see it peeling away there. And that's what we're talking about, this surface epithelial layer forming that canal wall skin as it goes along, and this migration process, the older sort of skin just starting to get pushed forward and replaced by newer skin and migrating out about 1 millimeter to 3 millimeters a month. Look how that's peeling away there, coming away. You can see the fresher epithelial it's not easy to say, guys. The fresher epithelial layer underneath, and then this dead layer on the surface. So what I always tend to do with this type of thing, I'll pop some olive oil in there. It's going to help this to come away a lot more easily. Now, don't forget, when we talked about the pars tensor, we are talking about a layer of the eardrum. We're talking about a section of the eardrum that's 3 layers thick. Epithelial layer, which is what you can see me just taking the dead version of that away. Then you've got the radial fibers and some circumferential fibers as well around the outside edge, which give it its structure, hold it in its right position, and keep its shape. And then you've got the mucosal layer underneath, which forms the middle ear wall. Now we're just peeling this away very slowly. Now, if we were doing this on the pars flaccida, I would be a lot more cautious with that. With the pars tensor, yes, you still have to be cautious, but it's got more structure. It's got those radial and circumferential fibers inside it, so it's giving it structure. Now, if we're looking at the pars flaccida, it's only 2 layers thick, epithelial and mucosal layer, so you're gonna have to be a lot more careful if you were taking this off the pars flaccida. There's more likely that you're gonna cause a tear up there. So this is coming away really, really well. Guys, I hope I'm not losing you too much for these medical terms. I will try and pop them on. If I mention them, I won't pop them on all the time, but just the first couple of times I mention, I'll pop them on so you can see what I'm talking about. But basically, we're just peeling all of this away. It's coming away really, really well. And this is another key factor in otomycosis. You will get these layers of almost dead skin lining that canal wall. So this sort of dead epithelial layer on the top that's going to come away really easily when you suction it. Case in point, take a look here. As we start to lift this up, you can see, look how that's just peeling away that whole surface layer. So this ear canal now looks clear. You know, we can't see any blockages in there. The skin looks a nice, healthy, pinky color, which is absolutely perfect. But that fungal infection, that Aspergillus infection, is probably still rumbling there on the surface. So we need to get those drops in just to try and get rid of that. Notoriously difficult to treat fungal ear infections. which is always better. If you can get rid of the debris first, then the drops can really act on the surface of the skin, really get to the root cause of that infection. So we're just peeling this away. This is the fine end we've got on here. The reason I've switched to the fine end, we're peeling skin cells off the canal wall. You need that really, really precise movement. You don't want to dig into the canal wall. There we go. There's the eardrum looking a lot better there. So this is what we removed. So we've got we've got 3 centimeters, 1¼ inches worth of wax skin and infected debris as well. So we've got the whole lot in there, guys. Well, guys, I hope you enjoyed that video as much as I did voicing it over. Don't forget, if you are still enjoying those medical terms, you did seem to on the last video, keep letting me know in the comment section below and I'll keep putting more of those in. If I'm going a bit fast or throwing too many terms in one go, also let me know. I'll slow it down, rein it in a little bit. But as always, guys, take care of yourselves, take care of your ears, and take care of one another. And I'll see you again real soon. Bye, everyone.